Hey everybody, Hyperacusis Hope. Today I wanted to make a video for friends and family of people with hyperacusis. From the outside, hyperacusis can seem pretty confusing, especially if the person that's dealing with it was not dealing with it before. Before somebody may have been able to go out and party and go to events, restaurants, work, school, whatever it may be. And I just want to acknowledge that from the outside, it's something that can look like somebody's kind of losing it. But the reality of the situation is that hyperacusis causes severe distress. It can feel like your world is falling apart, especially when sound is causing pain. Something like running water all of a sudden causing pain to the point of shutdown. Literal, physical, extreme pain. The way I like to describe how setbacks or, sound injuries while dealing with hyperacusis feels is imagine somebody just blew an air horn in your ear. It's gonna shake you, it's gonna rattle you. Your ear might even hurt, even if you have a healthy auditory system. But just imagine that lasting and continuing. And then, the water runs again, or a dish is dropped or something, and it's like an air horn gets blown again. And it takes a while for the system to calm down. And for some people, if the sound continues stacking, it actually lowers our tolerance to the point where it basically, people can become stuck. Sound is a fact of life. It's something that many of us don't even really think about. I certainly never really did until I got hyperacusis. My auditory system was perfectly normal for the first 28 years of my life until one day I was walking over a pedestrian bridge. A train went under, the metal wheels screeching on the tracks. Basically, it felt like something broke in my brain. It was a neurological injury. It was an injury to my auditory system. And since then, life has been very different. I spent a lot of time homebound, and I'm still at a place where I can't do so many things that I used to be able to do before. For the first year and a half, I was functionally homebound. I would go out for, occasional night walks and stuff, but I needed support, and I got support. And I truly believe that is what allowed my auditory system to rest and heal to the point where I'm able to now slowly start pushing. But everybody's trajectory is different. The prevailing advice for people who are dealing with hyperacusis, especially with pain, is to not push through discomfort, to stay in silence and be in as little stress as possible, to allow the auditory system to begin to heal. Everybody's trajectory is different. Some people are in a severe spot where even things like, flushing a toilet becomes impossible. Having been, the receiver of care in a caregiver dynamic, we don't want this. We don't want to have to ask somebody to, stop, making that noise or turn the TV down or off or use subtitles, or I certainly didn't want help flushing a toilet, I couldn't do dishes, for quite some time. And I'm super grateful because I believe being believed allowed the person who was letting me stay to understand what I needed and why I needed it. And so I just want to encourage anybody who is watching this that yes, it can be different, it can be scary, you know. I think that's one part that sometimes it's easier to not believe than to truly wrap your head around what somebody could be going through. And I think this is true for any condition. You know, you see people who are dealing with homelessness, mental illness, and you're like, you know, this could never happen to me. But the fact is, just like any other condition or accident, you know, hyperacusis does not discriminate. And it's so important to people who are suffering to feel safe expressing their needs. And it's also fair to acknowledge that it can take a toll on relationships. You know, nobody wants to have to be making these requests. And I do think it's important that people with hyperacusis recognize that, you know, these dynamics can be difficult on both ends. And what we, the sufferers of hyperacusis, ask is for that understanding as well. And so I hope that this helps sort of explain what the experience of hyperacusis can be like for people. And it doesn't discriminate. It can happen to anyone. Support makes all the difference. Hyperacusis hope. Peace out.